Hi. So I know that we've been getting a number of questions at our Joint Information Center about schools and how that whole process works with schools and kids who may become exposed to COVID or have an actual case of COVID-19 infection. So I just wanted to mention a few things. One is that we have to date, we have had one confirmed case in a child who may have been in the classroom during the infectious period. So we did have one classroom that was quarantined, and that worked out. We have had no additional cases where we have had to quarantine. It's important for people to remember that even if we do get a case in a child in the community, they may not be enrolled in on-site education, and so it may have really no impact on the school itself. Also, if we have a child who has a family member who becomes positive for COVID, that child is in quarantine but is not infectious unless they test positive. And so if they were in school and then get pulled out for quarantine, in most cases, there's no impact on the school setting. So the exception to all of that is a child who is actually COVID positive and attends school. And so to date, that has happened only once. If there were a large outbreak at the school, I cannot imagine that the entire community would not know that. When there is a case related to the school actually does inform parents and staff about there being a case without naming the person, so that there is an awareness there. And certainly the school is able to release any information to that fact that there is a case to the media, should they wish to do so. The way the notification happens for these, if we're doing a case investigation, we are looking at, for that individual case, we're looking at who all is in that home. Are there children in that home who attend school that are enrolled in on-site education? Are there adults in the home who work in the school setting? Then we are able to notify the school that we have an individual who is in isolation or in quarantine, will not be on campus until they were released by public health, and then we are able to notify them when they're released. The school is able to help us if we have a case that may have been infectious in the school setting. They're able to help us identify individuals in that setting who may have had close contact, so that informs our case investigation as well, and helps us be efficient and helps us ensure that we reach out to as many people as we feel may be impacted by that case. So far, the system seems to be working. It is a work in progress. As people can imagine, most counties in the state don't have open schools because they're in a tier that didn't allow it. And so we are in that group of counties in California that are able to have our schools open. And we are, basically working out processes and fine-tuning them as we go to make it work for everyone. Schools, families, and the Public Health Department CD team that's responding.